insurance marketplace, which is going to start taking place this year. And yes, I will also speak about Medicaid expansion, so let me get started. So first, I always like to put up this quote from my boss, Secretary Sebelius, because, especially you can imagine over the course of these last 3 years, I've many times speaking in front of audiences of people who do not support health care reform, who still do not support the legislation. I want you to know I respect that position, but if we can all remember that what we are trying to accomplish with the law is to make sure that all Americans have healthier, more productive, more prosperous lives, then I'm hopeful we can have a civil discourse on what we don't agree on. So why did we in the Obama administration feel that it was time to do something about health care? Well, first in this country, there's 48.6 million uninsured Americans. By the way, if I was standing here a couple of years ago, I would have said there were 51 million uninsured Americans. Thanks to the Affordable Care Act, that number has gone down by 3 million people, and I will tell you about that in a minute. Right now in this country, we spend almost $3 trillion annually on health care. It is almost 18% of our gross domestic product. That is more than any other country in the world, and even though we're spending all this money on health care, we're not getting the health outcomes you think we're getting. We're 45th in the world in terms of life expectancy, 29th in the world in terms of infant mortality rates. So we're spending all this money and yet not getting the health outcomes you think. And in fact, it was estimated that by the year 2040, if we did nothing about health care, a full 1/3 of our GDP would be going to health care costs. So we thought there was both a moral imperative and an economic imperative to do something about health care, and that's why the law got passed 2 years ago. So I'm going to tell you, I know some people heard me speak on the Affordable Care Act, so I apologize if it's redundant and all, but I'm going to tell you about the 7 or 8 provisions of the Affordable Care Act I think are the most important and how it's going to help people. So I mentioned a minute ago that we now have 48 million uninsured as opposed to 51 million. It's because of that first bullet point you see. So what took effect in September 2010, young adults up to the age of 26 got to stay on their parents' health insurance plan. 3.1 million young adults now have health insurance who didn't have it before. And, great news for parents and young adults everywhere, and that's why that uninsured rate has gone down. Secondly, contrary to what you might have heard, we actually strengthened Medicare. The Congressional Budget Office, which is a nonpartisan office of Congress, said we made Medicare solid for 8 more years, thanks to the Affordable Care Act. I could actually spend a whole hour just on changes to Medicare as a result of the Affordable Care Act. But 3 things that are important to know about changes to Medicare. First, what became true January 1st of 2011, if you're on Medicare, all your preventive services now are free. Those are things like mammograms and colonoscopies and Pap tests and PSA tests and flu shots. Those are all free for you now. No out-of-pocket costs, no co-pays, no deductibles. We're really shifting the paradigm in Medicare. We want people to prevent disease for people in Medicare, and if they do have one, that it gets detected early and we have a better health outcome. One quick example of this, we know that flu and pneumonia, you may not realize it, one of the top 10 leading causes of death are flu and pneumonia. And yet, only 58% of seniors over the age of 65 get a flu shot. And we were told by them that's because that $25 copay was cost prohibitive for a lot of people. So we made flu shots and everything else under prevention free for people in Medicare. Because again, we really want to prevent people from getting diseases in the first place. We think that leads to better health outcomes and actually saves the system money. But also became true, also January 1st of 2011, you get a free wellness visit once a year if you're on Medicare. So again, we're trying to keep you well. So if you have hypertension, or diabetes, or arthritis, or a cancer survivor, we want you sitting down with your doctor once a year and just talking one-on-one about you and how do you stay well. So again, free wellness plan visit, no out-of-pocket costs, no co-pays, no deductibles for that wellness visit. And then finally, the other big change to Medicare, the Medicare Part D prescription drug program that some of you are familiar with. There's a gap in coverage. We call that the Medicare Part D donut hole. It's that gap where you have to pay 100% of the prescription drug costs. Completely closing that Medicare Part D donut hole. It closes completely in 2020. But what started January 1st of 2011, we started putting discounts in place. So what became true January 1st of this year, if you hit the Medicare Part D donut hole, you get a 50% discount on brand name drugs, a a 21% discount on generic drugs. And again, that formula discount goes up every year until the year 2020, where there will no longer be any Medicare Part D donut hole. I think that's really important. Another longer, a lifetime limit on your care. And if you've ever had a catastrophic illness, you hit that lifetime limit very quickly. Usually it's about $1 million. So lifetime limit on care already went away. Annual limit on care goes away in January 2014. We're also doing something about reining in insurance premium rates. I could tell you a few things about this, but the one I'll really concentrate on is something we call the 80-20 rule. So what took effect September 2011 is from now on, insurance companies must spend 80% of your premium dollars on your medical services. It can no longer be for salaries or bonuses or trips to the Bahamas or marketing campaigns. It actually has to be for your medical services. So again, 80% of your premiums must be spent on your medical services. The other 20% is allowed for administrative costs. Starting last year, in summer of 2012, insurance companies had to start reporting to us at HHS that they were adhering to that formula, and if they were not, they had to give you a rebate. And in fact, 12.8 million Americans last year got a rebate totaling $1.1 billion. So again, provision working exactly the way we hoped it would. This next provision, which I think is actually one of the most important, is come January 2014, no one can be denied health insurance any longer if you have a pre-existing condition. And I guarantee you everybody in this room either has a pre-existing condition or loves somebody who does. 47% of Americans have a pre-existing condition, and last year insurance companies denied 625,000 Americans health insurance for a pre-existing condition. And it is not just the big things like if you've had cancer or diabetes, it's things like acne. One insurance company actually lists acne as a reason for why they can deny you health insurance. So all those go away in January 2014. It went away for children up to the age of 19 in September 2010. And for the 17 million children in this country with a pre-existing condition, that was great news. And finally, we're going to make health insurance more affordable for middle-class families and small business owners thanks to the health insurance marketplace. And I'll start telling you about that